question that I often get asked is how to anesthetize profoundly a mandibular molar, a hot mandibular molar, how to anesthetize it profoundly and properly for root canal treatment. My method is this. There could be a bunch of different methods, but this is how I do it. I start with the usual block, inferior alveolar nerve block. So I start with the lidocaine. Then immediately after the lidocaine, I go to marcaine. Again, IA block. I give things 5-10 minutes. I ask the patient if they have numbness, tingling of their lower lip on the corresponding side. If they do, then I cold test the tooth. If they don't feel the cold on the tooth, then I'm good to go. If they do, then I go to one more block with septocaine this time and a long buccal injection. Then I give things another 5 minutes, then ask them if they feel any numbness on their lower lip on the corresponding side. If they say yes, or it's more now, then I'll cold test the tooth again. If they don't feel it, then great. If they feel it, if they feel the cold test this time around also, then I go to periodontal ligament injections, multiple periodontal ligament injections all around the tooth. And I immediately then cold test the tooth. Usually PDL does the trick. Sometimes PDL doesn't do the trick. They still feel the cold sensation. Then it's time to go to intraosseous. And if you want to know how I do my intraosseous, I have a video on how I do my intraosseous injections using the X-tip. And it's in my highlights. So go to my highlights, look for intraosseous injection, and you'll find the video there. Intraosseous injections, 99% of the time, does the trick. I have had in the past 24 years a few cases that even with the intraosseous, the patient was feeling the cold sensation, and I started drilling on the tooth and they were feeling it. At this time, it's basically not so much so the feeling, the pain that they experience when I'm working on the tooth, is mainly the fact that now they've become kind of phobic. Now they're so anxious that they are anticipating pain. So as soon as I put the high speed on the tooth, they're kind of jumping. And that's not because they're feeling it, that's because they're anticipating to feel it. And at this point, I know that this patient, unfortunately, I can work on the patient, but they just don't have the nerves. They lost their nerves. So they're very anxious now. At this point, I just say, let's just stop it. And usually in situations like that, I go over the IV sedation with them, and they almost always take the IV sedation. They realize that this is not working out for them. And then have them come back, put them on antibiotics, pain medication, have them come back for IV.